Black women account for a disproportionate number of new HIV diagnoses among women. Additionally, Black transgender women experience the highest rates of new HIV diagnosis amongst transgender people and are more likely to remain undiagnosed and untreated compared to their peers. In response to this staggering trend, Gilead Sciences has launched the Setting the P.A.C.E. initiative. The Prevention, Arts, and Advocacy Committee and Education Program is a 3-year, $12.6 million commitment aimed at expanding HIV prevention efforts in underserved communities. Joining us now is Dr. Toyin Nwafor, hopefully I pronounced that correctly, Executive Director of Gilead U.S. HIV Medical Affairs, and also singer Raheem DeVaughn, who is partnering with Gilead Setting the P.A.C.E. initiative. Glad to have both of you joining us right now. Doc, I want to go to you first because here's the thing that jumps out, and I've covered this story for decades. And when you go back to the initial AIDS outbreak in the early 1980s, it was essentially a white gay man's disease. What ends up happening is you have all of these different groups that are formed in San Francisco, in Los Angeles, in New York, targeting these white gay men. Well, that actually played a huge role in creating the LGBT community, political advocacy organizations. What then happens is battles, whether it was a Democratic president or a Republican president, when you begin to see the numbers and the impact on Black people, you didn't see the shift of the resources going from white, gay, male-targeted community to African Americans. And so a huge part of this in the last decade or so has been this consistent battle on the ground in cities like Houston and Chicago, Charlotte. We talk what's happening on HBCU campuses, where the infrastructure, the federal money, the infrastructure still is not keeping pace with what the data actually shows. Doc, can you hear me?
Yes. Oh, I wasn't sure if that was a
yes,
question.
Go ahead,
yes,
go ahead.
So, okay, great. Yeah, so thank you for kind of summarizing, the last couple of decades of what we've seen with HIV. And when I started to take care of people living with HIV in the middle 90s, we did see that. And we saw again, over and over again, the discrepancy between what was happening in the communities and what the data was showing and what the perception and what the funding and all the realities of what was happening with that. And I think what's important is for us, like in the communities, in healthcare, in the media, to be able to talk about what is the reality of HIV in 2025, that there are still 39,000 new HIV diagnoses in the U.S. in 2023. And those numbers are disproportionately impacting Black communities, where, up to 38 to 40% of new diagnoses are in Black people, though we make up less than 14% of the population. And women, especially, when we think about 1 in 5 new HIV diagnoses are in women, many of whom are from heterosexual contact. And in those women, 1 in 5 infections are in women, but 50% of those are in Black women. So clearly, what has happened over the decades is that the reality of what is happening with HIV, who's living with HIV, who's vulnerable to new HIV infections, where the funding is, what's happening in our community is very different from where things are in the 80s, and the perception about where things are is very different. So it's becoming really important for us to continue to have the conversation, but also think about what it is that we need to do in the healthcare community, in industry, in the communities to change those numbers and make sure that we drive solutions for the epidemic.
When you talk about those numbers, a significant amount of that is in the South. Why?
Right. So again, when we look at it, you are absolutely correct. More than half of the new diagnoses of HIV infection are in the South. And in certain areas, and I know we'll continue to talk about those numbers, again, disproportionately impact people for a couple of reasons, right? So we have factors that have to do with a lot of social drivers of health. And it's unfortunate, but the reality is when we look at the diagnosis of new HIV infections, when we look at the overlay of diabetes, when we look at the overlay of obesity, other chronic conditions, we do see that disproportionate impact. And it's multifactorial, as you know, right? We have issues with, obviously, access to good quality healthcare, access to culturally competent clinicians who can have those conversations. We have issues with, obviously, funding, other social determinants of health that impair people's ability to actually get care. But then also, we also know that there is misinformation, there's disinformation, there's stigma. Stigma is a big driver of why we still continue to see disparities, stigma in the community, stigma in healthcare settings. And as long as there's stigma, it's really hard to have the hard conversations and the open conversations that need to happen around sexual health, sexuality, talking about HIV prevention, talking about sexual health. As long as there's stigma and as long as we're not having this conversation in an open, non-judgmental, stigma-free way, we're going to see those disparities, and they're layered on a lot of structural and social determinants and drivers of health that remain in the country.
Raheem, why did you decide to join this effort?
Well, I'm no stranger, Roland, to community activism, having the Love Life Foundation since 2016. I work as it relates to domestic violence. And this is no different. The statistics are outrageously, it's super high. Texas and Louisiana, Georgia, these are like three of my major markets as a recording artist, having influence, being in these communities for so long, making music that speaks, for the bedroom and to intimacy as well. And, it gives me an opportunity to do my part, just in terms of activism.
Obviously, when you think about, again, over the last 45 years, there's been no greater community that has really focused on HIV/AIDS than the entertainment community, primarily because it was the hardest hit by this in the 80s and 90s. We're talking about dancers, actors, singers, a lot of people who are behind the scenes as well. And so, this is certainly not new in terms of entertainers really taking this mantle. When you think about the concerts and the song that Stevie Wonder, of course, Dionne Warwick, Luther Vandross did. When you think about the galas that Elton John had raised millions and millions, Elizabeth Taylor as well. So there's a long history of entertainers focusing on this issue.
Absolutely. Being on board with Gilead this last year and a half has been a blessing. It's been, educational for me as well. Last year we touched over 40,000 women, had the opportunity to connect with over 40,000 women in less than 30 days. Utilizing my tour schedule to bring awareness to disparities and what's going on in the community. And I didn't really realize the impact until I'm in those lines every night, and different people disclosing and letting me know, hey, like I've been HIV positive since the 90s, or I lost my mother, I lost my grandmother, or my child has been diagnosed, or I've never been properly tested. Can I get tested right now? So again, I like to call it a party with a purpose, and edutainment, as we call it, where there's an opportunity to fuse and lock in and fuse education, with entertainment.
Doc, this is a 3-year, $12.6 million commitment. What does that actually cover? What does that involve? Is that advertising? Is that advocacy? Is that on-the-ground activations? What exactly is the initiative?
It is a combination of all of those things, because we do know that to truly talk about ending the HIV epidemic for everyone, everywhere, and especially looking at communities disproportionately impacted, like the Black community, we really need to approach it from a multi-pronged approach along the continuum of where people live, work, play, pray, and love, where we're talking about community activation. We're talking about strategic community partnerships. we're talking about education to the community, bringing on advocates and community partners. We're talking about educating healthcare providers so they know the vital role that they play in dismantling stigma and having open, non-judgmental conversations, not just infectious disease clinicians like myself, but primary care providers, OBGYNs, and so partnerships in that regard. Partnerships with media, partnerships with journalists and media, partnerships with community advocates, and really looking at all the people that it would take. Because as was mentioned before, stigma, as long as there's stigma, it impacts people's ability to want to get an HIV test. It impacts people's ability to stay connected in care and stay linked in care. So the more that we're able to normalize HIV and the community conversations around it, the more likely people are to step up to get tested, to know their status. The more we talk about things like undetectable is equals to untransmittable, which is a campaign that Gilead and a lot of other healthcare organizations are supporting, which says that when a person living with HIV is on treatment and they're on medications and their viral load is undetectable, that they cannot transmit HIV to their sexual partners. Undetectable is untransmittable. It's such an empowering campaign because it allows the stigma to be diminished. And if people can think about in the most intimate act, sex, you can't transmit. This will really eliminate some of the stigma that comes around people talking about HIV and other contacts. And so that's important. And so I think the answer to your question, it is multifaceted, a multi-pronged approach, looking at the community, the individuals, looking at healthcare systems, healthcare providers, looking at media, looking at housing, all of the things that it takes to get people to be tested, linked to care, access to care, providing support services, and making sure that we're using the data to inform how we deploy our strategies and do that in an effective manner.
Questions from our panel. We'll first start with you, Rebecca.
Sure. There has been a push in this country to eliminate comprehensive sex education in public schools, and especially in the South, where oftentimes it is an abstinence-only curriculum, and using the term curriculum very loosely. Considering that the majority of public school kids in this country now are students of color, is there a link between the lack of comprehensive sex education and the increased rates in unplanned pregnancies, STD rates, including HIV/AIDS?
Well, for sure, what is important is that there needs to be comprehensive sexual health education. And unfortunately, that is not happening routinely. And we're seeing that it's not happening at the different levels of education and even in healthcare systems where they should be happening. So what people are doing and communities are doing are finding really innovative and creative ways to have that education from trusted community partners. Different people are coming up with programs that may now be after-school programs that may happen in other places where people socialize so they can have that conversation if they're not able to have it within the school curriculum. There are places where people are looking at different ways of, the advocacy and community voice, going to their boards and figuring out how to have those conversations. Because when they happen, and people get accurate, factual information, you're more likely to have great outcomes, as opposed to when the information is disjointed and people get information from different places. So while people figure out how we can get policy and advocacy to make those things happen, a lot of times community organizations and community initiatives and parents and different people are figuring out different ways to do what they need to do to get it done and figuring out, and so many creative, innovative programs. And I think it's on to us to find programs like those and amplify them, because they are happening, where people are figuring out how to get kids together and have conversations with them. And how do we get people to know about those without reinventing the wheel?
And to piggyback, Doc, one of the activities that we did during the tour last year were community town hall meetings, meeting with the mayor, local high schools, faith leaders, and when we really start having the conversations and really chopping it up and understanding that this is something that's affecting the youth as well. They are sexually active. These conversations need to be happening, with our children, with our grandkids, so forth and so on.
Scott.
Thanks, Roland. Doc and Raheem, I've always thought your most powerful partner to do away with stigma in regard to HIV/AIDS would be the Black church. It's a complicated partnership and one that has been short or taken quite a while to come around, if at all. I'm curious that in your discussion, and either one of you all can take this question, I'm curious in your discussions with faith leaders from the 80s and 90s when AIDS was discovered till now, has the Black church been more active and been more open to partnering with you on this HIV issue, or is it still a struggle with those community churches?
Going from city to city on tour last year, this was a reoccurring topic for the room.
Yeah.
Definitely, there were faith leaders in the house that agreed wholeheartedly. They want to involve their local church. They're getting tapped into the community, and I think it has. We have seen a 360 turnaround. When you think about like the 80s and the 90s, and the conversations being said that they're taboo or shouldn't happen, at the sanctuary. I mean, I think we all believe in the power of prayer, but there's a saying that a friend of mine has told me that prayer without action is blasphemy. So, we have to definitely mob up and get with our faith leaders as well, and welcome the church into these conversations.
Yes, and like you said,
Right.
it's Oh, go ahead.
No, Doc, go ahead. Doc, go ahead.
Oh, okay. Yeah, just to piggyback on your point there, that as you go around the country, there are differences in what you see and how people are engaged. And like we think about anything like as a bell-shaped curve, there are going to be people on one end who are advocates and champions. There are going to be people who, won't move. But most people, it's in that middle part where you can have those conversations. And those faith leaders, their congregants, are their constituents. And so some of the things that happen is, going into those places and having them understand how this impacts their congregation, their community, and really looking at other things that they may find more important. So if you're going in there to do blood pressure screening, diabetes screening, talking about vaccinations, and then you can talk about HIV testing and sexual health, and sometimes finding the messengers from those congregants. So they may not want somebody from outside of their congregation to do the speaking, but really finding partners and ambassadors within those settings, and then having those faith leaders who are bought on to like talking about sex and sexuality be the ones influencing their other faith leaders. But you are right. They play a critical role and really important parts of the conversation.
Because for you, when we talk about teens that are sexually active and, parents having the conversations about birth control, for example, I feel like there should be conversations about PrEP.
Absolutely.
There should be conversations about preventative measures, as well.
Yeah, if we're thinking about preventing pregnancy, we're thinking about preventing HIV. And that's a great point you brought up, because the Center for Disease Control did change the guidelines 2-3 years ago now to say that anyone who's sexually active should have that conversation, the healthcare providers, around HIV prevention. So if you're having you're sexually active. So it's a really important time.
And get tested for it.
Yes,
absolutely. Get tested for it. If you're heterosexual, we tend to put this in our homosexual community, but this affects everybody.
Absolutely.
Joe?
And we talked about for cisgender women, that 91% of cisgender women who acquire HIV are from heterosexual contact. So we really say if you're sexually active, we don't need to talk about who you're having sex with, how you're having sex, what sex you're having. Really, if you're sexually active, let's talk about how you can prevent HIV. And that is part of your sexual health. It's part of that conversation.
And now they have
Doc, I follow our multiple chats, and not everybody is locked in it. So when you say cisgender, what does that mean?
All right, so that means women who are born female and who also identify as female. So that's what the gender at birth is, also their gender identity is how they're identifying.
Because you got folk who watch this show, they don't use all kind of different terms. They just use men, women. So they were like, I was looking, they were like, what is cisgender women? All right, go ahead, Joe.
No, thank you. Thank you for calling that out. We have to be always, thank you for doing that, because we always have to do that with any audience and make sure that we're clear. So thank you for doing that. So it's the sex assigned at birth.
Joe.
Also, we want to just touch on the fact that, now they have home testing kits as well. Same way you can go to CVS and get a COVID test kit. You have a home testing kit, so you can get tested, in the privacy and comfort of your own home. You can get tested with your partner. You swab me, I swab you. These are methods. Everybody seems to love that campaign, Yeah, but on a serious note, these are alternatives that exist out there. I think, again, it's about normalizing the conversation, about sexual health.
Mm-hmm.
All right, Joe, go ahead.
All right, guys, thank you so much, Brother Raheem. I appreciate your music, your work over the years. Like a lot of people would say, I guess Woman and Customer are probably still my favorite songs. But I think it's amazing that above your art, in addition to your art, which is already brilliant, you would actually connect with something that allows you. I mean, this is what you sing about. So it's a great fit and very as responsible as it is brilliant for you to be making this connection and to have this partnership. And I appreciate you for doing that. Doc, I want to add and ask, and whoever can come in should hear either of you, the fact that Gilead is doing what it's doing is great. Is there some pivot that you're making or some adjustment that you make or some raising of the stakes and additional monies that you're looking for, et cetera, and higher goals because of what we see happening on the government side? I don't know how much or how little you have government partners, but with the threats to funding that have happened, and even some people could actually even make this a DEI thing where you don't want to help women that, Black women who are disproportionately affected because it would amount to a DEI thing. Things that are that ridiculous are going on. So what I want to know is there some response from Gilead to raise the stakes, to raise more money, and to have even more targeted and higher goals because of what you see happening on the government funding and possibly the partnership side?
Great. Thank you so much for that question. And I think, like I started at the beginning, I am in medical affairs. I am Gilead at Medical Affairs. But what I can say confidently is that Gilead Sciences remains committed to making sure that we enhance access and commitment to make sure that people who need and want HIV prevention medications and treatment get access to it. And so there is a commitment for that. I am not able to answer like funding questions or questions around specific dollar amounts, but there is a commitment to health equity and to making sure that people who need and want access to our medications have that. And so that is that commitment and ongoing partnerships to make sure that that is happening. But I'm sure if there are specific questions around funding and the funding types, there are people within Gilead leadership who can answer that. We have people in public affairs, government affairs, and who are really working on those partnerships constantly.
All right, then. Again, when you talk about health issues in this country, this and so many others, African Americans are unfortunately at the top or the bottom, depending upon how it is rated. Absolutely, when it comes to getting the information out there, directing those media dollars to Black-owned media is important as well, not just ABC, NBC, CBS. And again, having those on-the-ground conversations that are the tough ones that folks don't want to have, but actually absolutely need to have. And so we certainly appreciate it. Thank you so very much.
Hello, I'm Isaac Hayes III, founder and CEO of Fanbase. Listen to what I'm about to tell you. The window to invest in Fanbase is closing. We've raised over $10.6 million of our $17 million goal. That means there's room for less than 6,370 people to invest in Fanbase for the average amount. The minimum to invest in Fanbase right now is $399. That makes you an owner in Fanbase today. Go to startengine.com/fanbase to invest. Why? Because current social apps have taken advantage of users for far too long, with content suppression, shadow banning, harmful racist content, and no real tools for monetization and equity. Fanbase has over 1.4 million users and counting, allowing anyone to reach all their following and monetize their content from day one. Social media is the new TV, and whoever owns the apps that distribute that content have the opportunity to own potential billion-dollar companies. While big platforms with uncertain futures are failing to serve their users, Fanbase is stepping up to fill the gap. Don't wait until it's too late. Invest now, invest for yourself and your future. Go to startengine.com/fanbase and own the next generation of social media.